So the first question I would ask is, when was your last menstrual cycle? If she's having menstrual cycles, then the next question is going to be just about menstrual history, how their cycles have been. You want to know about that because we're screening for something called polycystic ovarian syndrome, which is a huge problem, the most common endocrine disorder among reproductive age women. So we screen for that. And then if she says, well, I haven't had a menstrual cycle in 2 years, then we have to go a little further and say, okay, well, is that because you've had a uterine ablation, or did you have a partial hysterectomy? And so if she says that she had an ablation or a partial hysterectomy, then we want to do some lab work to see, are those ovaries still functioning? So we would draw an FSH and LH at that point to determine, are the ovaries still functioning or not?
It does actually occur occasionally that a 35-year-old woman goes into actual biological menopause prematurely, right?
Yes.
So there could be, that could have happened in the absence of any other pathology, right?
Absolutely. Women in their 20s even we have that are menopausal due to surgery or some other medical intervention.
Right.